Hey guys, Dr. Stafford here at Equilibrium Chiropractic in Greensboro, North Carolina. I'm really excited to come to you guys today to talk about a special case and introduce a patient as well as very special in my life, Pastor Aaron Willis. All right, how are you today?
I'm doing very well, Dr. Lee.
Wonderful, wonderful. Well, I want to again give thanks to him, one, for letting him videotape this, kind of this impromptu, just to talk about his care and his transition through our clinic from the first time we saw him and then to now where he is at now. So if you would, can you tell us a little bit about your condition and what led you to contacting and reaching out to the clinic? Well, I guess at that time it was me, not the clinic.
Yes, about a year ago, I was out in a field and I stepped back. I was doing some work and I stepped back in a ditch. I wasn't aware that it was there. It was a very deep ditch. And I fell in up nearly to my chest, and I slammed straight down and against the back wall. And I experienced a lot of discomfort at the time, but I virtually ignored it and went on for a few weeks, and then I started developing severe pain. It was just a deep, grinding, debilitating kind of pain.
Okay. And then from that standpoint, what was some of the path as far as the medical care that you did initially to take care, kind of see what was going on, okay, and then also seek for treatment to kind of help with this condition?
Sure. Well, first I went to my primary care doctor, and I was put on some pain pills and given some exercises and that sort of thing. And it never touched it. The pain got worse and worse. I was sleeping about 2 to 4 hours a night. I was utterly exhausted and up and down all night long, and it was just terribly, again, debilitating.
Okay. And then from that standpoint, that continued to lead you to get other answers to say, hey, obviously there's something wrong, right? The pain. Mm-hmm. You went from your primary. Did they refer you to another practitioner, or did you seek a secondary opinion?
Yes, I was referred to an orthopedic doctor.
Okay.
Very fine man and very conscientious, and
mm-hmm.
he treated me, did some injections, some cortisone shots.
Okay.
And also prescribed a routine for therapy. In fact, I did some in-house therapy for a time.
Okay.
And received a list of exercises, and all of those things helped initially a little bit, but the grinding pain just kept coming back.
Gotcha. Okay. And then from there, you received an MRI. I think they requested an MRI according to your patient notes that I received. That definitely showed, once I got it, was able to kind of read to you the degenerative disc disease in the lower part of your spine at L4, L5, and then L5, S1. It also indicated some facet pathology as well, the arthritis at that L5, S1
yes.
facet. You had the clinical history too of how many years ago was it prior where you fell off of your house and had a compression fracture?
Yes, that was about 7 years
and that was
ago.
T12.
Yes, and I did. It really traumatized my back.
Mm-hmm.
But I virtually got over that, and I was quite functional, and I did work as usual, and did a lot of the building on my new house, and a lot of the work. But it was when I fell in the ditch that I really had just some enormous dysfunction to deal with.
It caused an exacerbation and aggravated his condition.
Yes.
So from a standpoint of, tell them a little bit about, so you sought me out, okay, and then that's from a previous relationship with my father,
mm-hmm.
okay, so which I'm gladly thankful from that regard. Tell me a little bit about our care as far as how do you feel? One, it was kind of impromptu initially because I was initially coming to your home to treat you, right? Because this clinic hadn't been built yet.
Yes.
And I know I had hesitations as far as taking you on because I couldn't give you, in my opinion at that time, the standard of care that you needed to help you, you know, reach an optimal or, you know, stabilize at that point in time with your condition. So I think, you know, we were very hesitant at first. And then I think you had a very conversation where, you know, you had reached a threshold, a limit. And then, you know, I think especially with possibly doing more painkillers.
Yes.
Right. So if you could you elaborate a little bit more on that?
Yes, I wasn't getting any relief at all without painkillers, and I've never been on painkillers for any period of time. It was absolutely the only way I could get any relief. And I was trying to minimize that. I was cutting pain pills in half. I knew the you know, the downside of the addiction prospects and all of that, and I was working very hard to stay away from that. But I was truly desperate. And there's another phase before I came to you. I finally, out of desperation, I thought, well, perhaps there's something neurological going on or something deeper. And I went to a neurological surgeon, a wonderful man, just splendid in every way, extremely helpful. And I received injections from him, and that actually helped for a short period of time. But the pain had begun to telegraph up my back. And instead of my lower back just having just the deep grinding pain, I was getting a burning pain with extreme tension and tightness in my upper back and my neck and my shoulders, and that was extremely, I mean, that just really added to the discomfort. The surgeon mentioned to me, he said, well, sometimes with these things, even some manipulation, and suggested a chiropractor. And then, of course, I had learned that you had going into chiropractics, and I sought your help, and you so graciously came to my home because you weren't set up with your office at that point, and began giving treatment. And so that's when the reversal began to take place.
And it took a little while for that reverse to occur.
It did.
And you know, I think a thing that we did, of course, was the manipulation. You had one area of misalignment, particularly above that compression fracture, you know, in that T8, T7 region that we would continue to focus on. And I even remember the first time we did that manual manipulation in your back, you just felt like you said, I can take a deep breath in and breathe, you know. And of course, you know, he mentions, you know, some of the other conditions that he put on it's actually left shoulder complaint, right? It wasn't more so, the evaluation was done on the left shoulder. The primary did not evaluate your cervical spine, right? And I had evaluated your neck, and a lot of the pain was actually being referred from his neck down to his left shoulder. And the reason I can say that is they did an MRI of his left shoulder, and they only found a very minor rotator cuff tear, right? So obviously that's not keeping you from functioning in the way that you were. You had spinal misalignments in the cervical spine that we were continuing to address, at least from a mobilization standpoint, and then restoring normal motion. And that helped reduce a lot of his complaints in the upper back as well as that left shoulder.
Yes, I'd had some history with that left shoulder before my back injury, but it got much worse with my back injury. I received injections for that as well. Nothing was touching it.
Nothing was touching it.
After that first alignment, I could take a deep breath. First deep breath I took in weeks, and I was absolutely amazed. I was really quite skeptical in coming in because I thought I've tried everything and really there's nothing left to do. I've tried exercise, and I was desperate, and I was absolutely amazed that immediately I felt some relief. As you said, it was a process.
It's a process.
It took continued treatments, but every treatment I was getting, the pain was being reduced in my back, and finally my upper back. The tension and the burning in my upper back totally left. And when that happened, it seemed then the restoration of my lower back then began to accelerate.
Yes.
And it's still a process. Exercise has been very important, but I can virtually do everything today that I was doing before my back injury. I'm still working through some of the discomfort and the building up the core strength, but there's absolutely an amazing difference between where I am now and where I started.
Right, and I'm glad you brought on the core strength, because I know that was something, again, when I take a patient on, I think of a very, I think of a multimodal approach versus just a one size fits all. We talked about diet, right? We talked about nutrition, we talked about vitamins, we talked about your water intake, proper sleep position. We got you exercises and stretches, which were initially very difficult at first. How do you feel like those stretches are going now, and exercises are doing now, along with the alignments and the adjustments?
Much less painful to do, and they have made an amazing difference.
Right.
It's given me my mobility back.
And that was ultimately our goal. That was our goal, as well as to get you to sleep, for where you were sleeping again. So how many months had it been from the time that you fell and the pain really started to escalate to before you saw me, to where you had a full night's sleep?
It was probably about 5 months.
5 months.
Yeah.
So can you imagine 5 months without sleep? Because that's when our bodies heal themselves. That's when we relax, right? So that's incredible. That's incredible. I'm glad we were able to help facilitate that.
Yes.
From an impact, how would you say our clinic? It's not about me. It's not about myself. It's about you and your experience here. Miss Emily has helped out significantly as well. What would you kind of? How has our clinic impacted your life?
It's made the total difference. I think all of the treatments had their place, but I think it's that collective focus that really makes the difference. And I don't know how people would ever get total relief from back problems without the manipulation and the therapy, along with any other treatment that might be needed. But your service is what really helped me turn the corner on things. It
Wonderful.
Made an amazing difference.
Wonderful.
It truly did.
One of the reasons that I thought this was very important is, again, you, Pastor Willis, you're an extremely well-respected member of the community. He was my pastor as a child, and he helped save me in my walk of faith. And I'll tell you one little quick story as far as us, and I told him probably about the first or the second visit, but there was a time when I was probably about 7 or 8 years old, maybe 9 years old, and we were sitting on the front, I was sitting on the front pew of the church, and you're giving a sermon, and needless to say, I think I had got very comfortable in that seat, and I fell asleep in the very front of the pew. And I remember my dad coming up there, and oh man, he grabbed the heck out of my left shoulder, in embarrassment, of course. But no. So the thing is, and you've dealt. I think this is where I'm going towards with this stuff, is the opioid pandemic. Right? Nobody. I mean, there's people that are talking about it and its effects, but they're not really addressing the issue. Right?
No, just mask the pain.
They're masking it.
Yeah.
And the thing is you were having moderate to severe pain, which, yes, that does clinically give the referral or the prescription for opioids, but look at the toll that it's taken on our community. And so when I heard that, I was like, man, I got to get you in. I know I can help, So from that standpoint, because I've had friends that have lost their lives that started with an opioid medication. That's part of the reason why I became a chiropractor. and I'm sure you've seen that as well and talked with families.
Mm-hmm.
So when you hear that, you knew about the risk of the addiction component of it,
Mm-hmm.
right? Did you still feel like, even with that going on, some of your practitioners, were they more quickly to go for a painkiller, a prescription, than they were to think of other options outside of even, let's say, traditional allopathic medicine?
I did have the sense at times it was the easy and quick answer.
Easy and quick.
But I just don't think there is any long-term relief from that without, again, the spinal alignment and the exercises. Those are so important in building the core strength.
And that's a huge goal of our clinic, is building core strength.
And that's the harder path, but that's the only path that gets you to wholeness and restoration, I think, with back problems.
Yes.
It certainly was true in my case.
Yes, yes. And again, we started care probably at the beginning of March, and we're about the end of June. However, and now, we were seeing you about 3 times a week in the beginning. How frequently we're seeing you? About every 3 weeks to once a month now?
Yes.
And how is that doing for you from a standpoint of, do you feel like you've plateaued? Now we're thinking more so maintenance, in that regard.
No, I still have, some discomfort when I wake up in the morning, and working through that with the exercise, but I'm virtually on maintenance now with the manipulation and the treatments. It's just a great place to be. Just very happy with where I am at this point. Very happy.
Wonderful, wonderful. Well, it's been an absolute pleasure. Okay, first of all, being able to treat you, being able to see you get back to things that you love to do and enjoy and keep yourself busy. And then also be continue to go out to the community, right, and keep you back to where, hey, because pain dictates our perception of our life, right? If you're in so much despair, you're willing to do anything. So I'm glad to see that pain is not controlling your life.
It's not controlling, and I have my sleep back. I have it back so well, I go to sleep on some of my own sermons.
Okay. Okay. All right. Well, again, it's been a pleasure, and thank you for letting us videotape and then just talk about your condition, and just in the regards. Again, I think it's so important with regards to current health, because you do still see a lot of primary care physicians, nurse practitioners, PAs, giving it quick and easy. Give painkillers, muscle relaxers. And the long-term effects of painkillers and muscle relaxers, I mean, the addiction component of it. Of course, you're decreasing nerve pain. I mean, that's what we all have opioid receptors in our cells, in our nervous system, our central nervous system. Of course, those decrease those pain thresholds. And then also with opioids, you have an increase in dopamine. Dopamine's a neurotransmitter that basically helps with pleasure, okay? So it's kind of this cocktail, right, to help reduce pain and then increase pleasure. So that's why it's so addictive.
Yeah, they make you feel better for a short time.
For a short time.
They don't make you better. They don't.
That's right.
They don't produce healing.
That's right.
Yeah. Well, thank you, Dr. Lee.
Of
You
course,
have truly been a godsend in my life. Thank you so much.
All right. Thank you.